Does carnivore cause diabetes and make the blood sugar and A1C go up? Hi, I'm Dr. Eric Westman, and welcome to my channel where I review and debunk nutritional information online. This video was sent to me, thanks for sending the videos, by Lily Kane, who's an influencer and low-carb eater, flirted with carnivore, and I've kind of watched at a distance. I think she's got a lot of great messages, and she's interviewing someone on how the A1C and glucose rise on a carnivore diet is bad. Talks about insulin resistance. It's really helpful to understand what's going on if you want to. Wait till the end so you hear my final thoughts, of course. Before we get into the video, join me and keto nutritionist Amy Berger for a 7-day Start Keto Right Challenge starting September 24th. Whether you're starting keto for the first time or getting back on track, in this 7-day immersive challenge, we'll teach you the simplest and most effective way to lose weight. No tracking, weighing, or measuring needed. For just $10, you'll get daily live Zoom sessions with Amy and me, where you'll be able to ask questions and get answers in real time. Not only that, but my team will also be with you inside a private challenge-only Facebook group to make sure you have everything you need when you need it. You're going to be amazed at how much you learn and how much momentum you can build for changing your habits in just 7 days. To learn more or enroll, click the link below. I look forward to seeing you there.
You're saying low carb is a band-aid approach.
Yeah, it's really not something that we can understate. Carbs aren't the problem. The insulin isn't the problem. These are just symptoms. These are just effects of what's actually going on underneath. I was in that low carb camp myself and doing intermittent fasting and cyclical ketogenic diets and all the different variations. What we'll often hear is stop eating carbohydrates because that's where we're getting that glucose from. And that's also what stimulates insulin to be produced. And we see high insulin and high glucose and we say that's not good. So have less of those things. But we're really kind of looking at it backward, right? We're not actually addressing that underlying piece, which is that we're not actually using the fuel that's coming in. Instead, we're kind of training our body to expect stress more and more. And in doing so, it starts to downregulate our different systems, our immune function, our digestive function, our reproductive function, because this is not a time to be providing as much energy as possible and running at full capacity. I think sleep is one, if not the most common symptom when people are on low-carb carnivore diets. Just one night of poor sleep, that triggers stress, that triggers cortisol, that triggers anxiety and irritability. It is the same signal that causes fat storage, something we don't want to happen because that affects everything from how much energy we have, how well we think, our mood, and so many other things. One of the things that kind of flipped everything on its head for me that just completely shifted my perspective was...
Well, so this is interesting. If you watch my channel for a while, I mainly talk about keto diets, and carnivore is a subset of a keto diet, meaning that it stimulates ketosis, fat burning, and the fat gets metabolized into ketones, and ketones work where the glucose used to work in the body. But you've also probably heard me say that not everyone needs to do keto, or I'm not convinced of that yet. So it's a matter of matching the carb intake to your metabolism. And now what I've learned from these folks is they probably don't need keto. They probably don't need carnivore. And so, but there's another element to it, and that's kind of using an older way of looking at and definitions, interpretations of tests that I'd like to focus on too.
Throughout this video, Jay uses the word engine to represent mitochondria. The mitochondria is where our bodies produce energy. So for me to be able to clap my hands, move my arms, and talk right now, this all requires energy. And the energy is being produced in the mitochondria. So again, whenever Jay says the engines aren't working or the engines have broken down, he's referring to the engines being the mitochondria where energy is produced. Also, if you're new to the channel, my name's Lily. I'm a certified nutrition health coach, and I'm on a mission to help people live their most abundant lives, stop eating processed junk food, and eat more real whole foods. That said, I actually eat a pretty low carb diet myself, and I found a low carb diet to help me maintain my weight, have lots of energy, feel really good. And so there's some things that Jay says that I don't fully agree with him on, but regardless, I do have one-on-one clients who they've tried eating a low carb, keto, or carnivore diet, and it just doesn't work for them, and it actually makes their health worse. And so I hope that through this conversation, maybe for those people, they can have just some more ideas and a different perspective on how to optimize their health. I recognize the internet can be so confusing because we can find videos of people saying one thing and then find videos of people saying the complete opposite thing to be true, and it just gets very overwhelming and even frustrating knowing who to listen to and what's actually going to work. That said, I would encourage, if you're currently thriving eating a low carb diet, then I would not watch this video and start second guessing and questioning if what I'm doing is working. If you're currently losing weight, reversing your insulin resistance, feeling fantastic eating lower carb, then I wouldn't change a thing. But for those who aren't seeing success and aren't thriving, then I hope you find some value in this video.
And it's also helpful if you are experiencing an elevated blood glucose or A1C when you're eating a low carb, keto, and especially carnivore diet. We'll get into that in this video.
And today's video is sponsored by Lumino, which is the #1 oral natural care brand on Amazon. You guys know I'm very particular about the ingredients and chemicals and things that I'm putting in and on my body, and that also includes the things that I wash my mouth with. And so the Lumino products are certified non-toxic, microbiome safe, peroxide free, and enamel safe, using really clean ingredients like Dead Sea salt, coconut oil, and lemon peel. They're also a whitening toothpaste, and they also have whitening strips, which I used to use whitening strips in the past, but they had, lots of chemicals, peroxide, things in there that I didn't want to put in my oral microbiome. So I had stopped using those, but I now have found Lumino, which they've whitened my teeth, but they don't have those bad chemicals and ingredients that I don't want. So if you're looking for a cleaner product for mouthwash, toothpaste, whitening strips, then be sure to use the link in the video description to get 25% off the Lumino whitening pack, which includes 2 toothpastes and 7 strips of the whitening strips. Thank you guys for all of your support, and I hope you guys enjoy the video. Jay, we're going to talk a lot about insulin resistance, and I think just to give people, why should people care about insulin resistance? Why is this important? Why do you care about not having insulin resistance? And let's just start with that.
Yeah, that's a great question. And so insulin resistance is something that, medically is related to every chronic health condition. It's kind of the centerpiece of metabolic syndrome, which is then related to diabetes, cardiovascular disease, and tons of other related issues. So it's very central in terms of medical concerns. But in addition to that, what insulin resistance means is that certain aspects of our cells, some really important aspects, are not working well. And that's obviously something we don't want to be happening either, because that affects everything from how well we sleep, how much energy we have, how well we think, our mood, body composition, and so many other things.
Yeah, so insulin resistance, you've probably heard about that before. What causes it? Well, the traditional thought is that it's fat in the cells causing insulin resistance. Of course, if you take away carbohydrates or get people to lose weight by any method, really, that fixes insulin resistance too. And then the idea that the carbohydrate and insulin is making the cell less responsive is an issue here that you're going to get into a little nuance that I have a little different opinion than you're going to hear.
So it's a really central piece of health.
So what for you is the reason? I'm sure there's many reasons, but what causes insulin resistance?
Yeah, so even by its name, insulin resistance tells us that we're thinking about an issue with insulin, and that's kind of a step separate from the real underlying problem. So what happens in insulin resistance is essentially the mitochondria in our cells, which are the engines of our cells that use the fuel that comes in and convert it into energy. Those engines are not working properly. And so there is a kind of backup of the fuel that's coming in. So the cells are overfilled because the engines aren't working, and we can't fit any more fuel in. It starts to back up, and we start to see that fuel enter into the blood. And that's where you get high levels of blood sugar, high blood glucose. That's one very common feature of insulin resistance.
So, but let's just unpack that a little bit. The idea of insulin is that it facilitates glucose into certain cells, not all of them. In fact, there are a lot of cells who take glucose up without insulin, an insulin independent sort of uptake. So we're really talking about muscle cells here, where the insulin is the way that the glucose gets into cells. So you can look at insulin as a door to help facilitate the entry. of things into the cell, but also is it possible that insulin and this process here is also a door that keeps out the glucose? So why would cells in the body allow free entry of glucose? Well, glucose is needed there. It doesn't need insulin. Why would a cell require insulin for glucose to get in? So is it to facilitate the exit of glucose from the blood when it's high? Well, that's what it's being used for. Or is insulin actually there as a protector so muscles can actually run on fat and only allow the entrance of glucose when it gets over a certain level, or when the exercise starts demanding more glucose, aerobic exercise for that matter? So most people don't think of insulin as a door to keep the glucose out, but I do. And the free entrance of glucose into cells is a function of a phenomenon in the body. And so insulin is actually partially a door to keep glucose out of cells. So why would a cell not want the glucose? Well, it's full, it's filled. So instead of thinking of it as a backup of fuel not being able to get in, the fuel is actually, the cell is full of fuel, so it doesn't allow the glucose in. So here, the traditional view, and I've talked to researchers who are looking for that cause of insulin resistance inside that cell, inside the mitochondria. That's where the cause is. And they haven't really fully looked at and analyzed the inputs to the cell. So if you cut glucose down, which cuts insulin down, you actually fix insulin resistance. So you can't fix insulin resistance by giving more insulin. And actually, that's what most doctors do if they treat type 2 diabetes with insulin. They're not fixing the problem. The full cell doesn't need any more glucose fuel. Actually, what it needs is the fat fuel. Fat fuel gets to the mitochondria, and the glucose fuel stops the fat from getting to the mitochondria. So we're kind of looking at the problem from different vantage points and different perspectives.
The other is that insulin is the signal that helps to bring that fuel into the cell. So it's helping to bring, in this case, we're talking about glucose inside the cell so it can be used in the engine. And when the cell is full of glucose, because it's not being used in the engine, insulin can't do its job, right? It's not able to bring more glucose in, even though there's a lot in the blood that wants to be taken into the cells. And so
the cell is overfull of energy, well, of glucose energy, not fat energy. The muscle can run on fatty acids.
Our bodies try to compensate by producing more and more insulin. So you end up with those two basic features that describe insulin resistance, which is a lot of glucose and a lot of insulin, and cells that aren't actually using the glucose that's coming in, the carbohydrates that are coming in. And so that's kind of the essence of it, which then leads to a lot of other issues, because if our cells and engines are not working properly and they aren't producing energy, the ATP that is needed for every single cellular process, everything that we do requires ATP. If that's not working properly, then a lot of things are going to go wrong. And so that's really what insulin resistance is that situation. And then we're just seeing all these downstream effects as a result of it.
So how did we get to that being a problem? Was it someone ate too much? Was it ate too much of the wrong kinds of food? Was it sleep? Was it stress? Was it not exercising? Like, what is the actual action step where if someone's like, I don't want that to happen, I don't want bad things to happen with my cells and my mitochondria, what should they be doing on their daily, in a daily habit or lifestyle basis?
Yeah, and it's a great question, because what most of us think, or kind of the typical perspective, whether in the medical community or alternative health community, is that we're seeing all this extra glucose, we're seeing all this extra insulin, and instead of the recognition that the engine isn't working, we see all the extra fuel and we say the fuel is the problem. And so what we'll often hear is stop eating carbohydrates, because that's where we're getting that glucose from, that's where we're getting that fuel from, and that's also what stimulates insulin to be produced. And we see high insulin and high glucose and we say that's not good, so have less of those things. But we're really kind of looking at it backward, right? We're not actually addressing that underlying piece, which is that we're not actually using the fuel that's coming in. So that's kind of the first problem. But if we do recognize carbs aren't the problem, the insulin isn't the problem, these are just symptoms. These are just effects of what's actually going on underneath. Then we can start to actually address the underlying issue. And the kind of good and bad news is that everything that we do affects how well those engines work.
Yeah, so I don't agree with that. If that were the case, then using a low carb diet or even just caloric restricted diet or a medicine or weight loss surgery, independent of, I mean, I don't really focus on sleep much, and some people can't exercise when they come to me because they have knee pain. They don't even try to lose weight because they think they have to exercise to lose weight, but no, it's 100% diet. So if that were the case, then the approach that I use wouldn't fix insulin resistance, but it does. So when I look historically, Gary Taubes has written many books, Taubes, and he wrote one that came out this year called Diabetes, Rethinking Diabetes. And the history of diabetes treatment is that the insulin really wasn't ever measured until the 1970s when the technology became accessible. So people were treating diabetes with insulin, even type 2, without knowing that insulin was already elevated. So the insulin resistance is the pre-diabetes, the type 2 diabetes, and this can all be reversed by using the carbohydrate insulin theory, causing insulin resistance, and then reversing that.
So again, we're talking about the mitochondria here. And basically everything from how many nutrients we have, whether we're getting nutrients from our food, how much stress we're under, how well we're sleeping, how much we're moving, the kinds of foods that are coming in, the types of carbohydrates or fats that we're eating, how well our gut health is, or how good our gut health is, how well we digest our food. All of those things will end up affecting how well the engines work. And so on one hand, this means there's a lot that we can do to improve that situation. On the other hand, it also means that we have to consider all of these different aspects of what's going on with our health instead of just saying, stop eating carbohydrates. We actually want to look at all of the different things that go into a healthy life. And that's going to be where we can actually improve the function of those engines and actually allow for ourselves to use the carbohydrates that are coming in. And that's how we reverse something like insulin resistance.
So I had Dr. Ted Naiman on. Actually, I had multiple doctors come on and explain this kind of topic where people can be eating low carb and still have high glucose numbers and still be insulin resistant. I work with clients one-on-one, and for a lot of them, eating less carbs helps with their insulin resistance and helps with them improving their diabetes markers and blood panels. But then there's a select percentage of people who it just does not work. And like I'm thinking you're alluding to is that's kind of the Band-Aid approach. Oh, just don't have carbs. And that's like the Band-Aid approach, which is still not getting to the root cause. I've had certain people, and I had a client yesterday who there's someone who they can't lower their carbs anymore. They're at zero. They can't do anything else. And yet their fasting blood sugars are going up. Their A1C is going up. It's just something where what are we supposed to do? I can't reduce any more carbs. And so I've explained to them before, well, clearly your body is producing more sugars. If you then brought in some sugar, it would then allow your body to not have to be forced to create so much sugar. And then what ends up happening is, then their blood sugars end up coming down, ironically, and it's such a mind frack for them because they hear online, eat less sugar, eat less carbohydrates. And then I'm like, yeah, but you clearly are doing that right now. It's not working. So let's just try the opposite. And I've had people lower their blood sugar readings by 50 to 100 points in just a week or 2 weeks. And it's insane when I start bringing in more carbohydrates. And it's a mind frack. But yeah, could you add on to any of that? Why would people's A1C and glucose be rising without sugar?
Yeah, so I've had some people come to me with that same issue, and it may be you, where the blood glucose is still elevated and your A1C is even elevated on a carnivore diet. Dr. Shawn Baker, who is one of the carnivore diet book authors and had an elevated A1C, the blood glucose can still be elevated. I'm going to submit that is probably not a problem. Now, I don't know for sure, but we're carrying over the normal range for those who eat carbohydrate to those who don't eat carbohydrate. Even carnivores are not eating the carbohydrate. And I wouldn't expect Lily to really talk about it in this way because she's using the metrics that doctors have used for a long time. So the elevated blood glucose in A1C, when you're not consuming the carbohydrates, may be that you still have insulin resistance, which is from the weight. So if you're not at your weight loss goal, just be patient and continue to lose the weight, and the A1C and blood sugar should come down, blood glucose. Now, if you're at your lean weight or near your best weight of your life, and the glucose is still high and the A1C is high, you have to consider that it may just be assuming that the old numbers apply to this new metabolic situation. 25 years ago, when I first got into the low-carb diet world, I had several patients whose LDL went up very high. That concerned me. I mean, I had been inducted into the typical teaching of internal medicine and where LDL is always bad. I would even stop people in a clinical trial if the LDL went over a certain level. Now I don't worry about it, because metabolic syndrome, which is a different way to reduce cardiometabolic risk, is treated with a low carb diet, and the LDL isn't always a part of that metabolic syndrome. Same with blood ketone levels. Ketone levels are going to be higher and flagged as abnormal if you compare yourself to someone who eats carbohydrates. And so here, if you do eat carbohydrate, what's happening is insulin goes up to stuff the glucose into the cells. So the blood glucose may come down, and it may take a few days for you to get the insulin kind of back into full swing if you're eating carbohydrate again. But is that necessarily better? So I'm going to submit that the blood glucose itself and the A1C, which is more complicated because it's a reflection of the red cell survival time as well. The A1C is a complicated test and involves other functions in the body to be normal or not different. But certainly I've had people with higher blood glucoses and they're very concerned, and I try to reassure them. So if you're someone who eats carbohydrates, that glucose range is diabetes or pre-diabetes. But if you don't eat carbohydrates, it's very possible that that range is going to be different, very different. Like the ketones are different, like the LDL is different. And so, yes, you can exercise, and which was pointed out at the beginning of this video, exercise will bring down the blood glucose. And if it makes you feel better, then start incorporating the exercise. And again, matching your metabolism to the carb level, we still don't fully know how to do that. Although I know some people can eat more carbohydrates and keep the metabolic system, within a good functional range, depending on the exercise and your metabolic flexibility that you are genetically. So this is a common, I wouldn't say, well, okay, it's a uncommon but a recurring question that people have for me is, why is my blood glucose and A1C still elevated when I don't eat carbohydrates? And one way to raise the insulin level diet-wise is to eat some carbs. Your blood glucose comes down more. I don't know that that's necessarily better. The reason I don't know it's better is that glucose and insulin both are part of the story of insulin resistance and related to unhealthy outcomes. So if you keep the blood glucose down at the expense of raising the glucose, meaning you have higher insulin levels to keep the blood glucose down, it might not necessarily mean a better health outcome. That's why I ask people to get other measurements and be sure to keep following health outcomes, not necessarily intermediate outcomes like the blood levels.
Yeah, it's definitely something that I see as well. And there's a central piece there that's connecting the lack of carbs coming in and our body's producing a lot of sugar, and that's stress and energy. But just to bookmark that real quick, one thing you mentioned was when we take out the carbs, a lot of times we see the markers of insulin resistance improve, right? We see blood sugar decrease, we see A1C decrease, which hemoglobin A1C is an average measure of our glucose over time. And we might see improvements in insulin levels as well. But what we want to remember is that when we're talking about the fuel kind of overflowing, we're looking at the fuel and saying there's excess fuel here. If we stop providing that fuel, if we stop providing the carbohydrates, there will be less fuel. It doesn't actually mean we fixed the engine problem. It just means we're not seeing the overflow right now. And so that's important to recognize as well, which is that just because we're improving these markers of insulin resistance doesn't mean we're actually improving insulin resistance itself.
Yeah, so remember, fatty acids are used by muscles. The heart basically runs on fatty acid, the muscle itself. Skeletal muscle, the muscle when you run, you jog, runs on fat. Historically, we teach that sprinting or grunting kind of exercise requires anaerobic or non-oxygen dependent energy production, and that's based on glucose. But the latest information that I've learned is that as you adapt to a low carb diet, you're better able to use fatty acids, even at lower at levels where you wouldn't think you had the ability to use fatty acids and you had to use glucose. This is data and research that's relatively new, with Professor Timothy Noakes and Jeff Volek doing kind of simultaneously sorts of work. So don't forget that, don't be glucocentric. Don't just think about glucose as your fuel source. You also have the fatty acids and the ketones. The cells that really need glucose are the glia cells in the brain, so the parts of the brain, not the entire brain. The brain can use ketones really well. Other cells in the body that don't have mitochondria, the red blood cells, the white blood cells, use the glucose for a fighting infection function. So you want glucose in the blood. If you think about it, if you get an infection, the blood glucose goes up because you want the blood glucose to be elevated when you're fighting the infection. And then there's some cells in the kidney that have such a low oxygen tension that the body cells there in the kidney need glucose. Fortunately, the kidney itself can make glucose to kind of protect those cells so that they still have glucose. So other than that, the cells can run on ketones and fatty acids, including muscle cells, and so it's a little more complicated than it's being portrayed here. You'll want to definitely talk to someone who's trained and well versed in a keto diet. Influencers are fine. I find the discussion about the abnormal blood tests to be interesting, and the results are not fully in yet. For example, the LDL story is interesting, where it might not be an issue on low carb diets, or it still might. It's ongoing information collection, and there'll have to be study after study after study. If you've heard me on this channel, I will repeat that the hallmark of science is replication. So even though you have one study, you'll want to wait for that next one to be sure that it can be replicated. I'm going to end this video here. I wanted to talk about the elevated blood glucose and A1C on a low carb or carnivore type of diet, and at the same time reassure you, and then at the same time say I don't fully know the long-term consequences, but I'm not concerned, because you're not getting all of the carbohydrate that because you're not getting all the carbohydrate that's making the ongoing oxidative stress that is damaging in and of itself, independent of the glucose level. So, but I think this is a common influencer issue where someone expects everything to get better, but you're using the normal ranges and numbers that you would assume from those who eat carbohydrate to be true for those who don't eat carbohydrate. We don't know for sure. And in 20 years now, I've learned that LDL is not what I thought it used to be. And I was concerned about it then. I'm not so concerned about an elevated LDL if everything else is looking good. And that may be what's going on here. I don't know for sure. I hope you like it. If you like, please like this video, ring the notification bell, subscribe so you don't miss out on further content. I have new videos coming out on Wednesdays and Fridays. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out AdaptYourLifeAcademy.com.